In the past 24 hours, the number of patients being treated for COVID-19 at an area hospital has doubled. 41 Action News investigator Jessica McMaster shows us why now, more than ever, people need to stay home.
Health experts project half the people who live in New York City, where COVID-19 is rapidly spreading, will contract the virus. But what will happen here if we don't flatten the curve? Death rates in New York City skyrocketing, with crowded streets and subways to blame for the initial surge of COVID-19 infections. Here at home, in the past 24 hours, the University of Kansas Health System says their cases have doubled.
We are on the front end of the surge.
Chief Medical Officer Steven Stites says if we see the same spread here in Kansas City as in New York City, 1 million people could become infected.
That's a lot. That will be somebody you know. That will be someone you know.
But it doesn't have to be.
It's a choice.
While New York City is on the extreme end of the curve, the side no city wants to be on, other places like New Rochelle, New York, have gotten ahead of the curve, only seeing an increase of about 100 cases in a 2-week time period.
If you did doubling every 3 days, which is the mathematical model for the rapid spread of this disease, they should have been over 1,000.
And stay at home doesn't mean you have to stay inside. Getting outdoors and going for a walk is safe. Just keep your distance about 6 feet.
We can do this. We can bend the curve. We don't want to be New York City. We want to be KC.
If people at home do their part, Dr. Dana Hawkinson says they're ready.
I think if we can continue to do that, we can continue to stay at home for right now and continue to try and stop the spread and flatten the curve.
I'm investigator Jessica McMaster, 41 Action News.